Thank you very much, everyone. We welcome us to webinar 44 for AfriScience Network to be delivered by Dr. Ogbenyi Ugalahi on a presentation titled PhD and Fellowship, Complementary or Competing Pathway. I want to welcome every one of us to this webinar, and I believe we are going to have an interesting time to rub minds and learn and unlearn on this interesting topic. I want to welcome all professors and distinguished ladies and gentlemen. So I go about reading the citation of Dr. Ogbenyi Ugalahi. He's an academic staff at the University of Ibadan College of Medicine and a consultant ophthalmologist at the University College Hospital, Ibadan, Nigeria. She earned her medical degree from University of Ibadan and completed her residency in ophthalmology at the University College Hospital, Ibadan. She holds fellowships from both the National Postgraduate Medical College of Nigeria and the West African College of Surgeons. Dr. Ugalahi was a pioneer fellow of the Paediatric Ophthalmology and Strabismus Fellowship Program at UCH, Ibadan, and later completed a Commonwealth Short-Term Fellowship in the same specialty at Islamia Eye Hospital in Bangladesh. Our academic journey also includes a master's in global health and a PhD focused on improving access to eye care for children. Dr. Ogbenyi Ugalahi has authored over 50 peer-reviewed publications and has presented her research on eye care at numerous international, regional, and national conferences. She is an active member of the Ophthalmological Society of Nigeria, OSN, Nigerian Paediatric Ophthalmology and Strabismus Society, and other professional bodies. Her advocacy work spans both clinical and community settings, with a strong focus on expanding access to eye care for children. Dr. Ogbenyi Ugalahi is a reader at the University of Ibadan. He loves writing and has written 2 books on health literacy titled Fireside Chats with Dr. Ogbenyi, Volumes 1 and 2. She is also an avid writer on social media and can be followed on Facebook and Instagram through this handle at Ogbenyi Ugalahi. So I want to welcome Dr. Ogbenyi Ugalahi to make a presentation on the topic titled PhD and Fellowship, Complementary or Competing Pathways, webinar 44 for AfriScience Network. You are welcome, Dr. Ogbenyi.
Thank you very much, Prof.
Thank you.
Good morning, everyone. Good morning, my teachers. Good morning, professors in the house. Good morning, my dean. All protocol duly observed. So I was contacted to talk to this topic. I don't feel qualified to do so, but I'll try to do a critical appraisal of what PhD and fellowship is all about. And at the end of the day, I'll leave the audience to answer the question. So I would start with this by using this outline, and that's how I'll be addressing the topic. So by way of definition, looking at the dictionary, complementary refers to something, to 2 things serving to fill out or complete each other. And we see this when we do mixed method research, when we use quantitative and qualitative to complement each other. Or it could also be described as mutually supplying each other's lack. So we could look at it through this definition. This seems to be the most popular definition. Of course, there are some synonyms on complementary, say things that match, and that too can be something we may also look at if we are looking at the concept of PhD and clinical fellowship. But I want us to keep this definition in mind as we go on. Then competing is a state of rivalry or competition. So I just give these definitions to give context to what I'll be talking about. So by way of history, the PhD existed before clinical fellowship, and PhD refers to Doctor of Philosophy. In many definitions, is the highest academic degree in any field of study. But we also know that there are some other academic degree that correlates. So the PhD, by definition, wherever you open up to ask what's a PhD, you get it defined as the highest academic degree in any field of study. And philosophy denotes a love for wisdom or a pursuit of knowledge, for understanding, reflection. So the philosophy there, the doctor of philosophy there says that you're a doctor, someone who has pursued knowledge, someone who wants to know more, someone who needs to unravel things that are hidden. And so that's what the doctor of philosophy is all about. And the award of the PhD dates back to the 12th century, is traced to France, and they were said to be the first to be awarding this degree. But over time, the criteria evolved and different. You can actually find some differences if you go by country to country or from educational center to the other. So still on the history, Germany was said to have the most structured PhD program. They were the first. And this attracted students from all over the world. The program was structured. It had criteria for who could attain a PhD, for who could be employed. Is this from me?
Mojisola, kindly mute yourself, please.
I was a bit confused there. All right. So Germany was recorded as having the most structured PhD program. It had criteria for who could go in for a PhD, what was expected, the kind of jobs such people could do, and where they could be employed, and what was required to have a PhD program. And this appealed to people in the academia, and it attracted students from all over the world. And so it was a time that people journeyed to Germany just to go and get a PhD. And the need for this quest for knowledge was acknowledged by all, and the United States replicated the program, the German program, and they commenced awarding PhDs. Of course, things have been modified along the way. It's not the way it was that it still is now. The United Kingdom started with a Doctor of Science, and they were awarding a Doctor of Science before they adopted the German model of awarding PhDs. But the other doctorate degrees, which are not so popular, are still in existence. The Doctor of Science, Medicine, Music, Education, they are all still retained, but they are not as popular as the PhD program. So in Nigeria here, the first PhD, from what I searched, it said it was awarded to a Nigerian from the University of Ibadan. So the University of Ibadan was the first to award a PhD. Well, obviously so, it's the premier university, and this was done in 1964. And so universities within Nigeria since 1964 have been awarding the PhD degree. Coming to the clinical postgraduate fellowship, the historical context. The idea was bettered in 1905, but what the idea that was then was that physicians must dedicate themselves to a lifetime of study, because medicine needed you to keep learning, and we all know that medicine has evolved along the line. So the physicians had this understanding that they needed to dedicate themselves to a lifetime of study, and so they needed a program to produce continuous medical education. And so there were associations of physicians who were providing continuous medical education. They had clubs, they had associations that sit, review cases, review presentations, and all of that. Then a turning point came, the First World War. And we know, like all situations of wars, there's always a lot of human need. And so there was a lot of need for healthcare during the First World War. There was need for nurses, need for physicians who had specialized skills for all the things that were happening, because the war was not just about killing each other's enemies. People were maimed, people had diseases, there was hunger, there was outbreak of diseases. And we know that the first pandemic actually came just after the First World War. So this was the turning point for clinical postgraduate fellowship. And so after the First World War, and during the pandemic, the Spanish flu, a structured postgraduate fellowship training was introduced. And so it had curriculum, it was drawn, what needed to be done, how those who joined the program, what they need to pass through, what needs to be taught, and all of that, because there was now a recognized need for specialized care. And it was, of course, aimed for training of physicians in various fields of medicine. Okay, I'll stop here briefly just to say something again. This was supposed to be about all clinical postgraduate fellowship, but I'm limiting myself to medicine because in going into this critical appraisal, I realized that there were some bit of variances, some differences, and so I just want to focus on human medicine. So maybe during the discussion, we can talk about the other fellowships that are out there, but we know that there are quite a number. There is veterinary, which is also structured, but I'm not going to talk about that in my presentation. So back to the historical overview I was giving. So the objective then of setting up the clinical postgraduate fellowship, it was to train physicians in various fields of medicine. And as I said, it was because there was a need, the need for specialized skill sets were recognized. Surgical care was recognized as a primary care, not just something you do after if all medicines are failed. So all of those things were recognized that people need to go into different areas and study deeper into these areas to come out as specialists so that they could offer better care to improve outcomes. So in Nigeria before the 70s, people had to travel out of Nigeria. The World Health Organization was giving some form of fellowship to Nigerians, but in the 70s, the country recognized the need to establish the postgraduate colleges. And so the postgraduate medical colleges, both that of the West Africa and that of the National Postgraduate College, they were established in the 70s, and they were given mandate to produce physicians who are specialized and have the skill set in different areas of medicine for both the clinical needs and for the training of specialists. So we'll now leave that historical component of the historical aspect of the PhD and the fellowship. Now we'll talk about the components of both of them now. So for a PhD degree, what does it really contain? So the PhD has scholarship, okay? There's quite academic work there, and it depends on where PhD is being done. Some expect some structures, classroom work for at least the first 1 to 2 years of the PhD program. So you receive lectures and go for academic seminars and things like that. Others may not have these lectures, but you still attend academic seminars, present seminars, and all of that. It's a deep dive into research work, okay? So there's a lot of spending most of the time in developing research concepts, collecting data, and all of that. And this research most times is independent, of course, with supervision, but anybody going for a PhD is expected to be able to research independently. And the research work should advance frontiers of knowledge. So sometimes PhDs may be focusing on what's novel, what's the novel thing the research is providing. The rigor it requires a lot of work hours in a day, and probably in some fields you may spend the whole of the PhD program working from 9 to 5 or 8 to 4 or 8 to 5, or sometimes overnight, especially if you maybe your sample stage, you're working in a laboratory, and you need to run samples. Sometimes the PhD candidate may have to do all of that work over the night and so on. And the research work may sometimes be based on theoretical concepts, and it mustn't really solve a pressing need at that time. So that's for a PhD. Now, if a PhD student was teaching or is already employed in a university, then of course teaching forms a large part of the PhD program. In some PhD program, the PhD student is expected to take some seminars, teach some students, but this is not typical for all PhD programs. So there may be a PhD program that you probably may never have to enter a classroom to teach, or you don't have to really teach, but there are some that you act like a graduate assistant and do some teaching. Examinations can come in various ways. It could be by publication. So yes, after the research, you're expected to publish, and after the publications, you would then do some defend. Some other comes through defend of a thesis. And so you do all of that research and you have to defend the research work you've done, oral defense of the research work to the examiners and to other people who may be present. Mentorship is sometimes part of a PhD. You receive mentorship. In some PhD program, is not a formal organized mentorship kind of thing, but of course with supervision, it's expected that you receive mentorship and leadership. Okay, so leadership is also part of a PhD program. And what are the requirements to get a PhD program? A first degree. At least for Nigeria, I know that you have to pass through the first degree, you have to do a master's, and then you need, some people may do an MPhil, some straight from a master's to a PhD, and also the ability to perform independent scholarship and research. So these are the things that are required to do a PhD. I know in some other environment, you could actually go into a PhD straight from a first degree, but the PhD would differ a bit because you have to do some classwork before progressing into the research phase of the PhD. So basically, these are the requirements that are needed for someone to take on a PhD program. For the clinical postgraduate fellowship, yes, scholarship and academic work forms a large part of it too. And they are usually things that are clinically oriented, seminars, patients presentation, case presentations, and all of that. So it's part of it. Research, yes, research, independent research, but the research usually comes at the tail end of the fellowship, like in the part 2 phase of it. So it's not what the program starts with, because it has different kinds of things that you need to do: clinical learning, learn how to be independent in terms of offering clinical care before you go into research. So unlike a PhD that you actually just go there to research starts from the beginning, the clinical postgraduate fellowship, the component of it that addresses research usually comes after you've been grounded in the clinical care of patients. And research is also independent. It usually will address real-world problems. And it doesn't really have to be a novel thing, something that's never been done or all of that, because sometimes it could even be something that was done elsewhere or something, but because that is not addressing the real-time problems in your environment, the research in clinical postgraduate fellowship is actually expected to solve things that are real-world problems. It doesn't really have to be novel, groundbreaking. So that's usually the direction. In some areas, maybe they would want that, but for most clinical fellowship, I know it has to be research that addresses real-world problems. And clinical apprenticeship is a large part of the clinical postgraduate program. You learn to bedside manners, you learn how to speak to a patient, you learn how to take a history, you learn how to examine a patient, You learn practical skills, how to operate, identify instruments. So there is a lot of apprenticeship, and basically apprenticeship is actually all over for medical training, but in postgraduate clinical fellowship, apprenticeship is a huge aspect of it. And with that comes mentorship. So the postgraduate program has a lot of that apprenticeship in it. There's that issue of leadership and administrative work, chief residents and all of that. There is a lot of administrative work in that, learning to keep records, patients' records up to date, operation notes, if the surgical field, discharge notes, and all of those things, and keeping track of the patients that are seen in your unit, and mortality, morbidity, rounds, all of those things are part of what the clinical postgraduate fellowship also focuses on. Teaching is a large part of the clinical fellowship. Not necessarily that you're taught how to teach, but you actually have to teach. And so you learn on the job to teach. And so teaching starts right from the beginning of the program. You have to teach medical students. By the time they are in the second phase of the training program, residency, senior residency, you have to teach junior residents. And if you're in the surgical aspect where you have to teach practical skills, we have this thing of saying that you watch one, you do one under supervision, you do one unsupervised, and you teach the next. So practical teaching is actually a very large thing in clinical postgraduate fellowship, and there is no way avoiding that in the fellowship program. The examinations are a bit slightly different. We have the part 1 and the part 2, and in each of these, they have, it depends on the fellowship, on the subspecialty. So there's written, clinicals, orals, OSCEs, that's objective short clinical or structured clinical examination. And the part 2 also has written, clinical, oral, and then the dissertation defense. So the exams are usually in 2 phases. The part 1, which qualifies for the person to become a senior registrar, and then the part 2. So in some specialties, part 2 is just oral and dissertation. So you're expected to have like a 1 hour viva and then dissertation defense. In other places, you have to, in some other specialties, they have to be written and clinical. So what's required for someone to go into a clinical postgraduate fellowship in human medicine? You need a first degree, MBBS, or whatever variant of MBBS there is, and the primaries. A primaries is written after the MBBS, after the housemanship, and you have to, the individual needs to write a primaries. And after the primaries, then such a person qualifies to go into postgraduate fellowship. And so it's restricted to just people who have undergraduate training in medicine. So I'll try to compare and contrast the PhD and clinical fellowship. And so I looked at some characteristics based on what I have addressed in the initial slides. So they are both postgraduate academic degrees, yes. They address academic work and that scholarship, yes. They both have research, yes. Mentorship, yes. They have, they are structured programs, yes. There's a component of leadership in both of them, yes. Teaching, yes. So just the various degrees and assessments, they have both formative and summative assessments. So these are things that are similar in both of them, even though they may be achieved slightly in varying ways. Now, for the differences, some differences I could pick out. I'm sure there are still some other more differences out there that will probably come out during the discussion. So awarding bodies, the PhD is awarded by universities. In the early phase of clinical postgraduate fellowship, the at least that of where it started in UK, it was under a university. But eventually it was discovered that they needed postgraduate colleges to be able to streamline and look at the content and play an oversight role in ensuring that the curriculum and what is being taught addresses what needs to be addressed. And so that was how the postgraduate colleges came about. So they are usually not given by universities, and the clinical postgraduate is restricted to individuals with undergraduate training in that field. So if you want to do a clinical postgraduate fellowship in medicine, you have to have a background in medicine. Want to do a clinical postgraduate fellowship in veterinary, you have to have an undergraduate training in veterinary. So it's a bit different. Maybe a PhD, I could actually have an MBBS and I may decide that I want to do a PhD in African studies or something. I probably would just have to do a master's or so, and I'll be able to switch. And I know that this is a bit common in US because you could actually via from where you did your undergraduate training. So a physician can actually go and do a PhD in physics. But for someone with a physics undergraduate background to do a clinical postgraduate fellowship in medicine or veterinary is actually not something I've heard of, unless the person has to go back to go and have an undergraduate training in medicine. And that's because the undergraduate training in medicine is like a building block to what the clinical postgraduate fellowship is all about. Now, the scope of research work, I addressed that that the PhD, usually they are focused on novel research, something that advances frontiers of knowledge. You have to dig and all of that. But the clinical postgraduate fellowship says that problems in your environment, real life problems, how do you solve them? So it's possible that you can actually research on maybe dialysis, improving the morbidity from dialysis. So people are dying and you want to stop them from dying, so improve the morbidity from dialysis. That's acceptable under a clinical postgraduate fellowship. Publications in some universities, publications are required before you can be awarded a PhD. But in clinical postgraduate fellowship, there is no curriculum that states that you must have 4 or 3 publications or 2 or 1 publication before you can have a clinical postgraduate fellowship. But you do some research, but a publication is not compulsory. In universities where PhD is by thesis, publications are not required, but in some universities, PhD is by publications. And so after you've done your research, you must publish before you can have a PhD. And as I earlier said, that teaching for a PhD may not be a priority, but in clinical postgraduate fellowship, you must teach. And so you have to do bedside clinics, practical skills transfer, classroom, labs, wherever. And examinations are usually a bit more intense, and they are usually at several levels. For veterinary, I learned that the examination is like every year, but for human medicine, examinations are usually broadly divided into 2 parts. And then community service is expected in clinical postgraduate fellowship. The duration of PhD differs wherever it's being held. I know that in some places like Australia, you can do it in 3 years. In some other places, 4 years, some places 6 years. So I just looked at averages and I said average of 4 years, but this 4 years duration is actually dedicated to period of intense research. And for clinical postgraduate, the minimum is 4 years for some specialties, while others have a minimum of 6 years. So looking at the pathways for someone with an MBBS in terms of this clinical fellowship and a PhD. So after an MBBS, the individual could decide to go into a clinical fellowship or could go obtain a PhD. But for the individual to be able to offer clinical teaching, specialized medical practice, leadership in clinical care, or clinical research leadership and supervision, they need to go from the PhD into the clinical fellowship to achieve that. But with an MBBS and a PhD, individuals can function very well in basic sciences. And this is the mandate of the National Postgraduate Medical College. That's what is stated on their site. And in practical terms too, that's what is obtainable. The MBBS, PhD, basic sciences, laboratory research, yes, function excellently. But if such an individual needs to go into clinical teaching, you have to cross from the PhD into the clinical fellowship to achieve that, because of what is obtained in the training. That is a lot of clinical exposure. So now I've done some critical appraisal, the training of a PhD candidate and a clinical fellow, a fellowship, a postgraduate fellowship, is geared towards working in some environment. So if such individuals want to work in an academic environment in the universities, to say, what are the roles and how do these programs address this role? So the roles of an academic staff includes teaching, includes research, includes administrative duties, it includes leadership, providing leadership in research and in every other sphere, university leadership, and also community service. So from the things I have said, do these two programs independently provide this skill set that is required for an academic staff in the university? I would say yes. So after the critical appraisal, I did a rapid assessment of 7 participants. And these participants have both a PhD and a fellowship. Most, at least the people I know, they had fellowship before they had their PhD. So I asked 2 questions, trying to ask concerning fellowship or PhD. So I asked the first question, that fellowship or PhD, which one provides the most skill sets for your job? And 5 of them said fellowship does. 1 said both the PhD and the fellowship, and 1 did not respond. So the further probing, I got 2 responses, and 1 said the PhD cannot provide the clinical skills required to function as a clinical lecturer. For academic research, leadership, publishing, etc., the PhD is valuable but not essential in my opinion. And that was the response of 1 of them. The other said, while the fellowship has helped me greatly with the clinical skill sets, the PhD strengthened my research and teaching skills significantly. And that was the response of another person, the person who said both. So I also asked, oh, sorry about the numbering, I went from 1 to 3. What was I thinking? So the person who, I asked the second question, I said, do you think a PhD is required to effectively teach in colleges of medicine? The first person, 4 people said no, 1 said yes, 1 said it depends, and 1 did not respond. And the further response was the PhD is definitely not required for effective teaching in clinical medicine. We do a lot of case-based teaching. For supervising postgraduate students, it is also not required, though could be valuable because of the structure and rigor in the training for the PhD. So these were the response to the brief survey I did. So from all of what I've said, this slide is the only slide that gives my own personal opinion. All the other slide, I just did a critical appraisal, but this last slide is the only slide that gives my own opinion about the topic. So I reflected, asking, based on the definition of complementary and competing, I asked some questions, and these were my own personal answers that I've written here. So I said that the PhD and clinical fellowship are distinct postgraduate programs designed with distinct skill sets for the purposes they serve. So in a way, it's not that for the purpose that these things were deserved, that they are lacking, and you need the other to complement it, or you have to do one to complement the other. It actually depends on what exactly it is that the skill set is required for. And if the skill set is that, okay, I have a clinical fellowship, but I need to do immerse myself in research, have a laboratory, I want to find out the, like, give an example, maybe the neuro something of a disease, and you need to do a lot of laboratory work, and you think that, oh, my clinical fellowship doesn't give me time to sit in the lab, and I need some new research methods, some new laboratory working method, then maybe a PhD is the way to go. You may need to do a PhD in that area that you think you probably are deficient in. Or maybe you want to go into medical education, and you said, oh, after my clinical fellowship, medical education, I need to know the methods, the best way students need to learn, the this and that and that and that. And so maybe you want to do a PhD in education or a PhD in medical education, yes. But in terms of what the programs were designed for, they have distinct skill sets for the purpose they set. And then I asked further that, can PhDs replace clinical fellowship in clinical medical education? The answer is an emphatic no. And I also further asked myself that, do clinical fellowships alone provide the necessary manpower and skill sets requirement for medical education? Yes, in a way, with continuous medical education. So this is my attempt at addressing the questions, and I thank you for listening. I'll leave more room for the audience to discuss, and we can see how we are able to answer these questions from different perspectives. Thank you very much.
Thank you very much, Professor Mary Ugalahi, for that interesting and detailed presentation, PhD and fellowship, complementing or competing pathways. So the floor is now open for questions, clarifications, comments, contributions.
Good morning, everyone. My name is Soumya Dagbe. Thank you so much for the very, very, very clear and lucid presentation. I really benefited a lot. But I know that there's the scope of the talk is not basically about trying to compare an MD to a PhD, but I often hear that a PhD and an MD is equivalent. Now, I don't know if you're able to shed a little light on if a PhD was more superior than an MD.
PhD and MD. Now, there are some bloodlines in that, because in the US, an MD is usually given to people who finished an MBBS. So, but the UK Doctor of Medicine is a doctoral degree that is awarded to people who have done excellent research in medicine. So the doctoral degree, Doctor of Medicine, is not such a common degree that is awarded to everyone, but usually it would have been that you've done a lot of research in that field, the field of medicine, for which you have been awarded that degree. So it was looked at as a higher degree than a PhD in a way, but it's not open to everyone. So that's the issue there. So you have to be someone who is practicing medicine, doing research in medicine, and then you can have that doctorate in medicine. But the issue here is that if you say MD, you have to qualify. Where are you speaking from? Are you speaking from US, or you are speaking from the doctorate in medicine? So that's where there's usually some, the lines are not so clear. Okay, but if it's MBBS and PhD, the US MD and PhD, then that's a different ball game. Of course, the PhD gives you more in-depth into research than MBBS or the US MD. I don't know if that answers your question.
Yeah, thank you very much. I appreciate it.
Well, let me say thank you so much for this lecture. If I have to give it, probably I would also have followed the same pathway. Maybe we'll start from the last one. Let's remember that the US MD is not a first degree. You must have done a first degree before doing
MBBS.
their MB, because they don't equate it to MBBS, which is a first degree. The US MD is a second degree.
Yes.
So if you have it, you can do a fellowship. You have no business doing a PhD except you have an interest in that area. I mean, focusing researching a particular point. Now, I want us to look at the UK, because UK brought higher education to us. And they still run the MD program of the UK, still a common. If you go to all the UK universities, most of them doing postgraduate program, they still run their MD program. For those of us who are here, you can also look at the postgraduate requirement for MD or PhD in Oxford or Cambridge, because those degrees are rated as the same. Because the problem, I guess the person who is asking it, there have been people who have done MD and they go back to their universities and people are fighting them that it's not equal, or you cannot use it as a PhD degree or whatever. So, and if you look at the University of Ibadan, for example, MD has existed as far back as the PhD program. It's just that the uptake has not been that high. There's a program that is run in the UK, even up to today, and it's a common degree for medical graduates. Now, I don't want to say that you can't do a novel program even with your fellowship research. So it depends on how it is structured. In the UK, where we model most of the things we do in Ibadan or in the postgraduate college, after your part one, you are given a protected time of 2 years to go into research. That's after the part one examination, maybe MRCP or MRCS. If you have opportunity of acquiring a grant to go and do research, you can take a leave and go and do a thorough research that can be awarded as an MD or a PhD, and then you return back and finish up your fellowship training. But that is their own pathway. So I'm just looking at it in terms of international approach to it. So, but because of the limited time and the requirement for clinical skills and all those, you may not have enough time to do a deep dive into research, except when you finish your fellowship and you have time to do some research. That's the only area I wanted us to, I wanted to make an input. You can really do, if we structure a program, give people time to run maybe 1 or 2 years to do research and then come back and finish up the training. But I guess we have not developed to that extent. But by and large, for you to teach medical students or resident postgraduate students, there's no way you can do that without obtaining a clinical fellowship, which is actually very thorough. You have to work from sometimes 24 hours in the hospital, learning, teaching, offering community service, and so forth and so forth. Thank you very much, Mary, for this excellent presentation.
I'm in the public health space, and
Yes.
I just wanted your opinion as a clinical personnel. In terms of running, we have what we call FELTIP, that's field epidemiology program that is being run across the globe. And then, of course, the PhD aspect too. So what advice will you give to a professional that has interest in working in a public health research institution, conducting active research, but looking at either taking up a fellowship or a PhD program, and then what have you, just that career navigation or the navigatory pathway. So I just needed your
Okay.
opinion too, your input. Thank you.
Okay. Incidentally, I did my my master's and PhD in public health because I wanted to have a public health view to the clinical aspects of the care I offer. So I decided to go into that way because I have a fellowship in ophthalmology, and so I wanted the public health aspect of it. And because I didn't want to, I cannot go and start doing another fellowship in public health. So I took up the postgraduate degrees, master's and a PhD in that, so that I could merge the public health to my clinical specialization and look at things from different perspectives. So if you're in the public health field, I can't say I'm an expert in public health, but my own candid opinion is, what exactly do you want to do? So if you are not offering a lot of clinical care, maybe you're looking at health policies, health infrastructure, epidemiology, diseases, things like that, I would say a PhD in that area would suffice. I would say so. But if you need to be in contact with patients, you have to offer specialized care in any form, then I guess that's where the fellowship becomes important. So a PhD in public health actually addresses many areas of public health, and I would say that suffices. But maybe people in public health may tell me differently because I'm not a public health physician. I just have some, I have training and experience in it by virtue of what I did. So maybe somebody in public health that is in the house may be able to assist you more than I have. Thank you.
Good morning, everybody. Thank you so much, Mary, for that eloquent delivery.
Thank you, ma.
I was a bit offline for a while, but I don't
Yes.
think anybody has two postgraduate medical colleges in Nigeria have become very proactive. Number one, the National Postgraduate Medical College of Nigeria is what they call it, is empowered by law to be able to award PhD degree, and that is started now. So you can actually combine your fellowship and your PhD program together. In some instances, your dissertation will just be a bit more rigorous, be a little bit more expanded, and you can actually finish everything, including your fellowship and the PhD program within 5 years or 6 years max. So it's now doable because of that one. And I think in many faculties now, under National Postgraduate Medical Colleges, the PhD program have started. Of course, they already started the MD program. So they've added the NUC approved. They have the power, just that they're not using it before. So if you're interested, you can actually have the skill. And I believe the younger ones coming up should try to have the skill, you know. Then for West African College of Ojo, being a West African a regional body, they don't have that power that national has, but they have MOU with at least 10 universities now, including Opo University. They are with Ondo, they are with all the geopolitical zones. 1 or 2 universities have MOU that you can do your PhD with your fellowship pari passu. So that all those opportunities are now there. So it's not as if you finish fellowship then you can start doing PhD, because like Mary said, there's a lot of overlap in all these things. It just get from one thing to the other. You cannot. Nobody is going to come to hospital and say that somebody with PhD should come and do surgery on them. Not going to happen. And many novel things that have been developed through the medical system, like people doing research on stroke, dementia, and all that. So we are focused on health issues. So I think that we should encourage our younger ones, for whatever, just close your eyes, do this too. Just like in those days, Professor Lagunde, you can't even go near him unless you do the psychology. You must do it's also if we say, okay, when you are coming in, go and register for your PhD. And we mentor them, and sooner or later we'll overcome all these things, because we are doctors. And I know, even if you want to go into engineering, if you are interested, you should be able to go into it. So I don't think that should be a big problem for us, because we spend so much energy fighting this thing. And I think it's time for us to just move on. And in the last 3 or 4 years, even some of our doctors in this field, consultants, they have double PhDs. Double. Some have 2 PhDs in different areas. So, like Mary and I didn't even know that they had PhD in public health. So it's very interesting. So thank you so much for this lecture, this eye-opening. And unfortunately, those who are here, it should be our younger ones. I don't know what the team can do to get those younger ones to listen to this and get our medical students and all that. So maybe it was nice information to you. Thank you very much.
Okay. Thank you very much, Dr. Mary. Maybe I should ask this question in closing the webinar. There's a general notion about the issue of PhD and fellowship regarding research, which I wanted to clarify. It's believed that, well, it could be a wrong notion, but at least I wanted to answer it and put it on record, that those that go through fellowship without PhD, they are not really sound in research. That PhD is the actual research-focused qualification, that if you don't have PhD, if you have fellowship, you can't be competent in research. I know it's a wrong notion, but I want it to be on record in your answer. And then it's believed that fellowship is if you want to have a clinical competence, it's fellowship, not a PhD. People argue for and against, and we've had different cases where people will say we can have PhD in surgery and not be able to operate in the theater. That we can have PhD in maybe reproduction or female reproduction or whatever, and not be able to operate CS or orthopedic surgery. That PhD is more of laboratory sciences and culture and the stuff. So I wanted to clarify this area of fellowship, research competence, PhD, clinical competence. Thank you very much.
All right, thank you very much, sir. Well, at least I can say I'm speaking from experience and what I know. The PhD is not designed to give you clinical competencies, unless a new degree does come forth and it's called a PhD, but it's teaching clinical competencies. Otherwise, PhD, by the virtue of its design, the nature of its design, can't give anyone clinical competencies. And in clinical teaching, as I said during the class that I elaborated a bit, there's a lot of apprenticeship. So if I want to learn how to do a deep tendon reflex, I have to learn it from someone. I can't even just read a textbook and then go and hold somebody's leg and start hammering, putting my patellar hammer to see whether, I can't even say if these deep tendon reflexes are pronounced or they're lacking, but I would have been exposed. I would have watched someone do it. Someone teach me the proper way to handle the patellar hammer and all of that, also that I'm able to do it. So there is a lot of practice practice, hands-on practice in clinical fellowship. And that's because the program is designed to provide specialized clinical care. So that's what it focuses on. Part of it focuses on teaching doctors how to provide specialized care. So I'm an ophthalmologist. It takes you doing certain number of cataract surgeries a week to be proficient within a certain period. So all of that is actually laid out. So you have to train to do a cataract surgery, and you have to train to maintain your proficiency in cataract surgery, and you have to keep doing, not to lose the skills. So it's like, if I go away for a month and I come back, I want to start doing cataract surgery. In fact, I have to go to the wet lab and reorientate myself into how to do a cataract surgery again, because it's a microsurgical surgery. I have to be sure that my hands, I'm able to do it. If not, the risk of having complications increases. So if I have a PhD in ophthalmology, by the way, the PhDs, and I can tell the molecular everything of a cataract development, and I have all of that, I know all of that. But for the fact that my brain and my hands have not been trained to perform a cataract surgery, there is no way I can perform a cataract surgery. Now, to teach another person how to perform cataract surgery, I myself must be competent in doing a cataract surgery to be able to teach someone else how to perform a cataract surgery. So you keep doing to teach. So that's why it's actually a given that if you don't have a clinical fellowship, you cannot teach clinical skills. You can't teach clinical things, or so to speak. So basically, I think that maybe is for people who are outside medicine, so to speak, but for anyone who has ever have that, a clinical fellowship is required for you to teach specialized clinical care. So even to teach MBBS, you need in clinical medicine, not basic medicine, but clinical medicine, you need a clinical fellowship, because it's the only way you can acquire the skill set to be able to do all of that. Now, for research, whether PhD and clinical postgraduate, which one gives you more advantage in research? Honestly, I would say that if you spend 4 years of your life just doing research or doing most of research, of course, you'll be more proficient in research, if compared to someone who probably did 2 years of research. But that is not, that's not overall for everybody, because people leave clinical fellowship with 14, 20 publications by the time they are finishing their residency. And that's because such individuals may probably find themselves in an environment where there's a lot of research ongoing. And so they were put into the research program early in the training. And so while they were learning the clinical aspect of the clinical fellowship, they were also learning research. But if it's the way, if an individual was not in an environment where there is a lot of research ongoing, the person who does a PhD would have some advantage in the research know-how compared to such an individual who does a clinical postgraduate. So these are the balances. But that if you do a postgraduate fellowship, you can't be proficient in research. That's not entirely true, because research is training. So if in clinical fellowship you do, you have to do a research, by the time you're done and you're working in a research environment, you can still do more research. And in fact, the evidence is everywhere. There are many people who have they have done a lot of research and they never had a PhD. I have a colleague who is one of the highest, one among the people with high citation in UI, and we just finished our PhD together last year. But all the research work he did before that was based on what he had the clinical fellowship with. So that's my own response, really, that but there are some kinds of research that maybe is laboratory based, and you are doing a clinical fellowship in something like ophthalmology, but you want to do genetics, you would need a PhD in genetics to go into that, or a clinical fellowship in genetics to focus on genetic research. I don't know if that answers the question, Professor Sheto.
Yes, thank you very much. Thank you. You really addressed the aspect. I actually wanted to be on record because after this webinar, you see people on the platforms asking for the slides, asking for the recording that they couldn't make it. Thank you for making the clarifications. Thank you very much. So in the absence of further comments, we want to bring the webinar to a close. On behalf of AfriScience Network administrators, we want to appreciate Dr. Ogbenyi Ugalahi for doing a good job on the presentation titled PhD and Fellowship, Complementary or Competing Pathways, webinar 44 for AfriScience Network. We also want to appreciate all the participants. I can recognize many of our big people in the medical field. Professor Akin Komigodu, the immediate past Provost, College of Medicine. You are welcome, ma'am. Acknowledge your presence. The Dean of Clinical Sciences, Professor Taolawa, Professor Kechukwuoga, Professor Mojisola Atalabi. You are welcome, ma'am. We acknowledge your presence, and all other people. Thank you very much for taking part in this webinar. All others that are present, sorry if I can't recognize you. You are also acknowledged, your presence is acknowledged. Thank you very much. So this brings us to the end of this webinar. AfriScience Network hosts a webinar, minimum of once in a month, or once in a while. If we have interesting topics or by arrangement, we might have up to 2. So this brings us to the end of webinar 44. Another one will be taking this next month, June, by God's grace, and the announcement will be shared across all our platforms. It's also an interesting topic. So on behalf of AfriScience Network, we want to wish every one of us a nice weekend. Thank you very much, and God bless you. Bye for now.